We have a very complicated situation that is potentially interfering with the doctor-patient relationship and the ongoing care that is necessary to be delivered to these people. The continuity of care is something that is essential to maintaining appropriate medical standards and treatment for our patients. We hope that we can avert any problems with this by proper communication with our patients and the insurance provider in letting our patients know that they have alternatives and they have the rights to make decisions with their insurance coverage. The concept of insurance companies suddenly interfering with doctor-patient care is troubling. This makes it very difficult for the doctor-patient relationship to continue and to allow for appropriate continuity of care to make sure that the disease states that these patients are being treated for are appropriately met, the needs thereof are appropriately met. This is the challenge that faces us and the relationship with our patients as we move forward with healthcare in Nevada. Unnecessary changes in primary care physician handling of patient disease states, particularly chronic disease states that have ongoing management of their conditions throughout the year, multiple times per year, patient-doctor are meeting and assessing their disease state and making sure that goals are being met and we're preventing the most common sequela from untreated chronic disease. Probably the most common thing we're dealing with is the combination of hyperlipidemia, hypertension, and diabetes. These disease states mandate that if we are to reduce the risk of heart attack and stroke, the most common sequela thereof of untreated disease states such as these, it is essential that we have ongoing management that is diligent and vigilant about the goals that the patient has and the physician has for those patients. Due to the fact that our contract was being canceled as of September 30th, 2011. It's troubling that these patients are being called and told by letter and by phone that this is necessary. My discussion with this particular patient was that we would be happy to go ahead and try to facilitate contractual relationships with the insurance company, Health Plan Nevada, so that his continuity of care is not disturbed, and that we at Healthcare Partners are committed to making sure that he receives top quality health care in a timely manner. The prevailing theme right now in regards to patient concern is the very fact that a relationship has been formed with their primary care physician and they feel comfortable handling their disease states and multiple issues that we talk about day in and day out every day as physicians try to match the needs of their patients. They now are being thrust into a different relationship with a provider whom they do not know and don't have a foundation with. And it's very frightening for people who don't understand the very rights and privileges that they've earned by having a Medicare beneficiary policy, that they can make their own decisions. These people can go back to Medicare, they can make decisions to change to another insurance company, but they need to understand their rights are as such, and we hope that we can communicate this effectively to our patients so that they can ask appropriate questions and make decisions that are in their own best interest.